Wait, it wasn't recording. Go ahead.
Son of a gun. Brain cancer is a tumor that takes up space within the skull and can interfere with normal brain activity. It can increase pressure in the brain, shift the brain, or push it against the skull. It can damage nerves and healthy brain tissue, which influences symptoms that occur. Usually, a brain tumor is named for the cell type or origin of the location in the brain. This helps doctors determine the type of treatment needed. Symptoms include headache, stroke, and they depend on the tumor's location in the brain. Gradually, you will have a loss of movement in an arm or a leg, unsteadiness or imbalance, especially if associated with a headache, loss of vision in one or both eyes, especially peripheral vision, double vision associated with headache, hearing loss is possible with or without dizziness, speech difficulty gradually happens. Others can include vomiting or nausea. This is more common or severe in the morning. Confusion and disorientation. Also, memory loss. Brain cancer is more common in adults, but there are some types that occur only in teenagers. Identifying a brain tumor will usually involve the neurological examination, brain scans, or analysis of brain tissue. Neurological examination is a series of tests that measures the function of the patient's nervous system and physical or mental alertness. Brain scan is a picture of the internal structure of the brain, and some brain scans will consist of a dye, which helps the doctor to determine normal or abnormal brain tissue. An MRI is scanning that detects a signal emitted from normal or abnormal tissue. A biopsy is a surgical procedure in which a sample of tissue is taken from the tumor site and examined under a microscope, and it will provide info about abnormal cells in the tumor. It is the most accurate method of obtaining a diagnosis. One type of brain cancer is glioblastoma, and some characteristics are that it is the most invasive type of tumor. It commonly spreads to nearby tissue, and it grows rapidly. It includes distinct genetic subtypes. It may be composed of several different kinds of cells, and it may have evolved from a low-grade astrocytoma, and it is common in men and women in their 50s and 70s. More common in men than in women, and accounts for 17% of primary brain tumors. Some treatments are radiation, which shrinks the cancer cells. Surgery removes it completely, and chemotherapy kills the cancerous cells.